back to MTN Live in the Mountains. So here on the couch with us, we have Dr. David Linzey, and he is with Animal Emergency and Pet Care Clinic here in Boone, North Carolina. So let's throw out a little statistic here first off. North Carolina alone has over 430 animals that have tested positive for rabies, which is the highest number of cases in years. So that is a big number right there. But what is the rate of rabies maybe in Watauga County?
Well, there's always I think virtually all those cases are probably among wild animals. So we primarily see rabies in foxes, skunks, raccoons, and bats are the four major species of wild animals that we normally see rabies cases in. Fortunately, very few of those get transmitted to pets because pets are kind of the link between the wild animal population and us. We rarely come in contact with a lot of these wild animals that are potentially rabid, but our pets, if they're free roaming through the countryside, oftentimes will encounter these animals, kind of in their roamings, and potentially can bring that back to us. So that's kind of the main concern as far as rabies. Not uncommon in the wild animal population,
but we haven't had any cases here.
There are usually every year several cases in Watauga County. It seems to be kind of seasonal, and usually summertime is when we primarily tend to see a little bit more frequent cases coming up, and the health department and animal control usually deals with most of those things, but all vet offices in Watauga County deal with this kind of on almost not a daily basis, but on a fairly regular basis. So.
Now, how does rabies actually get started? I know it's transmitted through a bite wound, but it's an actual virus. How do you know how it kind of originated? Yeah,
it's a viral disease that basically is maintained in the wild animal population, and it's always there. It's always out there, and there are animals that are rabid all the time. We just don't usually interact with them or see them very often. So it's passed through the saliva, through bite wounds. So bite wounds are usually the main thing we're concerned about when people are handling animals. Scratches too, but primarily because of the salivary transmission, it's usually a bite wound that we get concerned about. And it circulates, all the time, but like I said, mostly among the wild animal population.
What are some signs that your pet or maybe a wild animal has rabies? Like, let's just say you're camping and you see an animal walking around, just to make sure that you're safe and you stay away from it.
Yeah, and you always hear about like the foam of the mouth too. Is that
Sure, that's kind of the typical thing that everybody associates with. And Old Yeller, as Alex mentioned earlier.
Old Yeller.
Everybody associates rabies with Old Yeller, I believe. But foaming of the mouth is a typical sort of a symptom, mostly because they can't swallow. Their muscles in their throat area are paralyzed and they can't swallow, so they tend to kind of foam. But I usually tell people when they're outside in the outdoors and they see an animal that is behaving inappropriately, then that's often one of the considerations. But a lot of these animals that I just mentioned, bats, foxes, skunks, and raccoons, basically oftentimes are nocturnal animals. So typically they're out during the nighttime hours, and we don't normally see them during the day. But any animal that normally should be out during the evening hours and is out traipsing around during the daytime hours, oftentimes we get reports of raccoons in particular that are trying to get into dog pens or dog kennels and things. That's not a normal behavior for a wild animal.
Right.
Approaching people, not being scared of them as normal wild animals are. Any of those sort of behavioral sort of symptoms are probably reasons to take a wide berth.
Right. Now, once your animal has rabies, can they live with it? Is it? I know it's probably ultimately a fatal disease.
Yeah, and North Carolina and the United States in general has taken a pretty aggressive approach to making sure that animals are vaccinated, because if they're vaccinated and then they become exposed, then in theory they are protected from infection. Once they start showing clinical signs and they start doing the salivating or the abnormal behavior, there's no treatment at that point. And generally they're either euthanized and then tested in Raleigh, especially if there's been somebody exposed, if there's a person that's been exposed, because we would need to know if they were exposed to a potentially rabid animal to undergo treatment. And there are treatments for people that have to be initiated fairly soon after exposure. And it's not, from what I understand, a very pleasant process to go through. But
sure not, yeah.
A lot of vet staffs actually are vaccinated for rabies, which everybody finds really impressive or interesting, because we're kind of high risk. We oftentimes deal with a lot of these animals every day, and we never know when one may be coming in. Some odd symptom it's got might potentially indicate that it may be rabid. But
is there anything someone can do to protect themselves from rabies?
Well, the vaccinating of our pets is primarily the main way that we control this disease, and it's fairly well controlled, like I said, among pets, not as much in the wild animal population, but vaccinating your pets in all the state laws are slightly different, but in North Carolina, all dogs and cats that are at least 4 months of age, by the time they are 4 months of age, 16 weeks, they are required by state law to be vaccinated for rabies. The first vaccine they get is always good for 1 year, and then all the boosters after that are good for 3 years. So I think pretty much everybody realizes, even if you're just taking minimal care of your pet as far as veterinary sort of care, then at least everybody knows that rabies vaccines are important, and that's why. So.
I understand that. So you guys do rabies shots at your place?
All vet clinics offer rabies vaccinations, and then most counties within the state have low-cost rabies clinics, usually scattered throughout the year at various different locations, schools, community centers, places like that. Oftentimes on weekends, and they do kind of low-cost vaccines just to make it more available to the public.
So can anyone call you if maybe they're around a pet or a wild animal that thinks there is rabies present? Well, what can someone do?
Usually we suggest they contact Animal Control, Watauga County Animal Control, and they usually will investigate if there's a way to capture the animal that's exhibiting the symptoms, and they'll usually do that and test them. If they, the main concern is if they've exposed a person or there's a human that's been involved or exposed. Raleigh gets inundated with situations of animals. Somebody calls up and says, I just saw a skunk traipsing around in my yard, and they want it tested, but they can't possibly test every single animal that people call about, so they really kind of confine the testing to animals that have exposed a person or when there's been a human exposure. So.
That's great. Just if anyone else wants to find out anything more about what you guys do, is there a phone number they can call? Or?
Oh, they can call our office, which is 828-268-2833 is our clinic. And like I said, any vet office in Watauga County or the state, for that matter, offers rabies vaccinations. If they have any questions, Animal Control also is another source of information.
And how much are rabies vaccinations?
Yeah.
They vary. Some of the lower cost clinics, I think, are probably in the $8 to $10 range for a vaccine, and most clinics, maybe a little bit more than that. Probably somewhere in the $12 to $18 range, probably just for a vaccine. So.
Awesome. Do you want to tell us, maybe the audience a little bit about what else you guys do at your clinic?
We're a full-service veterinary hospital. We're open 24 hours a day. Normally we see emergencies, situations in the after hours, nights, weekends, holidays, things like that. And then during the daytime, we do see emergencies as well, and also have a general practice. So do vaccinations and spays and neuters and dentals and all the normal things that vet clinics usually do. So, and we offer all those services. So.
Awesome. Well, thank you so much for
Sure.
coming on and educating us about rabies. Because
Yeah.
it's a big deal,
It
especially like if you're out camping or out in the woods, or if your pet. No one wants their pet to contain the rabies
Sure.
virus.
You get exposed to it too. And if you get a vaccine, go ahead and do it, right?
That's the main thing. We try to encourage people just to make sure they're vaccinated, and then if they even get exposed, then they should be protected. So.
That's awesome. Well, thank you so much
Yeah.
for coming
Thanks
on
for
and
having
talking
us.
with us.
We're back in a minute with more MTN Channel 18.